Hello, my name is Kat Keane, Health Educator at Arthritis New South Wales, and welcome to the Empowering You series. In this episode, I will be talking to you about pain and chronic pain and how to reframe the way you think about pain. I hope you enjoy. Let's talk about how we're going to reframe your pain. Before we get started, we just need to say, as the disclaimer reads, that every effort has been made to ensure that the information is accurate and reliable. However, it is just general information and advice, and that we encourage you to always consult with your doctor or healthcare provider to obtain individual medical or treatment advice. So, to challenge your idea of pain, we're going to have a look at the role of pain, the difference between acute and chronic pain, how to reframe your pain, so ways in which to think about it a little bit differently to help you understand it better, and then having a look at some tips in how to manage your chronic pain. So first of all, what is the role of pain? Pain is a part of the body's defense mechanism. It's there to protect you against painful stimulus or danger, for example. It protects you while your body is healing by certain mechanisms, for example, swelling, for example. And it avoids, or it tries to avoid, that harmful situation in the future. So it's an important part of life. It's vital to healthy survival. It's adaptive. It's highly sophisticated, and it's adaptive. It saves our lives, essentially. Pain, and the feeling of pain, should I say, is important to our survival. Pain is a very personal experience, though, and it is both a physiological or we feel pain because of a physical experience that puts us in danger, but it's also very emotional as well, hence why it's an impersonal experience. It occurs when and where the person says it does. Pain is brought into the subjective awareness through the perception of noxious sensory inputs, and these noxious sensory inputs or stimuli can either be mechanical, thermal, or chemical means. So, for example, mechanical could be it could be a form of pressure put upon us, or strain or movement. And thermal example could be heat, for example. And chemical, when we have inflammation, there are certain chemicals released that irritate receptors that pick up danger, or the ones that we perceive as pain. And it can be very much influenced by an individual's mood, their psychosocial factors, depression, which can be mood, anxiety as well, stress, work, general life, family. These things are the social part. And also what we call DIMS, or dangers in me. And these are generally cognitive or thoughts. They're basically thoughts. They could be fear thoughts, the meaning, the impact of an injury, and certainly past pain experiences. All of these influence our pain experience. So it could mean that we feel pain more, for example, or less, but usually more. I'm sure that you've experienced being highly stressed or anxious, or even really tired, and your ability to cope with pain is essentially maybe weakened, and you're more sensitive to pain. So that's just an example of how these certain things can influence our pain experience. There are two different categories of pain. One is acute and the other is chronic pain. So for acute pain, the onset is sudden, and it's usually because we have an acute injury. For example, stepping off a step, the bottom step, or gutter, and you roll your ankle and you damage the tissues on the side of your ankle. Now, depending on what tissues you've damaged, each tissue has a certain, approximate healing time. So it can take days to weeks to heal. But the expectation is that it will heal, it'll be cured, and you'll recover. And as your tissue starts to heal, the pain also dissipates as well. But something can happen within that process whereby the pain persists and it becomes chronic pain. Sometimes you can pinpoint when the injury occurred. So say it was a low back injury, perhaps you lifted something heavy, for example, and you hurt your back. It takes a month or two to recover from that, and then your pain should dissipate. However, it hasn't, or it doesn't, and it just continues for 3 months or 6 months and beyond. So it's a chronic process that occurs over time. Sometimes, however, the onset is quite insidious and you can't pinpoint a time where you might have injured yourself. It just sort of came on. But yes, the duration is more than 3 or 6 months, and it just continues. And the expectation is, well, it's a bit different than chronic pain. The tissues have healed. If you've had an injury, the tissues have healed, and yet the pain persists and it's ongoing. So it's really about coping. It's coping and strategies in terms of managing this pain. So chronic pain. Chronic pain is extremely complex to understand and also to treat. Essentially, chronic pain is classified as a nervous system or central nervous system condition. Changes occur in both the central nervous system and the peripheral nervous system. So the mechanisms in which modulate and interpret our pain, let's just say, are injured or damaged. Just like you can injure your muscle or your bone, you can break a bone, but it can heal. But the same way, you can actually damage your nervous system. So your central nervous system is made up of your brain and spinal cord, and your peripheral nervous system is all the nerves that run off from the spinal cord out to your peripheries, fingers and toes. And both of these sections of the nervous system can be implicated. So central pain mechanisms operate at the level of the central nervous system, of course, and this can lead to enhanced widespread pain sensitivity. Individuals with augmented central pain processing will display diffuse hyperallergia and allodynia. And these are two just fancy words that just describe the way in which we experience pain. So hyperallergia is a process whereby we feel increased pain, so more pain than we normally would from a painful stimulus. It could be a needle or a punch to the arm, or something like, okay, something not so dramatic, like maybe you have an elastic band around your wrist and you flick it. You can feel a bit of pain from that. But with hyperallergia, that pain sensation is increased. And with allodynia, this is actually a stimulus that doesn't cause pain, not even discomfort, but you actually feel pain. A great example of how to explain allodynia is clothes. So you wear clothes every day, maybe, but you generally don't feel the clothes on you, or if you do, you forget about the feeling. But it certainly doesn't cause you pain. But with allodynia, the example would be that that clothes sitting on your skin actually causes you pain. So a lot of changes are occurring in your brain at the level of the spinal cord and in the peripheral nervous system that are either picking up too much stimulus, that are either sending too many messages to the brain. The brain is interpreting this in a poor way or not the correct way. It provokes more of an emotional response than a general physiological response. And I am trying to explain this as easily as I can, so very layman's terms. But essentially, our coping mechanisms, our modulatory mechanisms are injured, if you like. So pain is a very complex perception. It is a perception. The mechanisms in which pick up stimulus, pick up danger. So they pick up danger stimulus, and our brain interprets this as pain. And remember, pain is protective, and we want to avoid pain. So that's how we interpret it in the brain. But our skin and our fingers and our muscles, they don't actually feel pain. Our brain interprets these things as pain. But it's not only a physiological reaction, it's also based on experience and prior experience, and by the context in which this noxious stimulus occurs. So a noxious stimulus is basically just a stimulus that endangers our tissues, our body, okay? This sensation is also influenced by our emotional state, very much so. Remember, like stress, mood, for example. Therefore, the response to pain and pain management can vary from subject to subject, which is why you may find that something works for you but doesn't work for somebody else. And it's also why that people with chronic persistent pain may take medication, but yet after a while, their pain still persists. So we need to think of chronic pain, not just acute pain, while it is influenced by emotional state and context. But chronic pain is very much influenced not just by the bio side of things, so, you know, the actual trauma that occurred, the tissue damage that occurred, but we have to understand that pain isn't just due to tissue damage. It's also due to psychological aspects like poor sleep, anxiety, depression, our coping mechanisms, and the social side of things. Are we supported? Do we feel alone? Do we feel isolated from work, family, our social network, and our general functioning of daily life activities? Okay, so all of these need to be addressed. Okay, that's the first step of reframing your pain. It's not just about addressing the physical side of things. Or my muscle feels sore, I must rub it, for example. Or I've got a scratch, I must put a Band-Aid on it. We need to address the other aspects of it as well, because they very much implicate our perception of pain. Biological, psychological, and social influence perpetuates chronic pain. Number 2 is that there is generally no tissue damage when it comes to chronic pain. The pain you feel when it is chronic isn't because you've damaged tissue. Hurt doesn't equal harm, or generally not always anyway. Yes, for acute pain, yes. The pain that you feel is likely because you've done tissue damage, okay? You've just rolled your ankle, that's gonna hurt, you've done tissue damage. But remember, when it's chronic, so 3-6 months and beyond, your tissue has healed. It's got nothing to do with your tissue now, it's to do with everything else. So not the bio, but the psychosocial, mood, attention, behavior, memory, context, thoughts. All of these are what feeding or driving or ramping up your pain experience. Medications alone are not the answer. A common medication used for chronic persistent pain is opioids. And research shows that long-term they're not effective, that we can develop a tolerance and in effect an addiction. High dosages can actually lead to an increase in our pain experience, and this is called opioid-induced hyperalgesia. And of course, there's a whole heap of unwanted side effects as well. The same goes for non-steroidal anti-inflammatories like an ibuprofen or a steroid, corticosteroids, those sorts of things as well. They're great short-term. But long-term use, they can actually have the opposite effect or cause further damage. We need to address the 4 Ps when it comes to pain. Prevention, of course, is best. We need psychological intervention. We need physiological or physical activity, exercise, physical therapy intervention. And yes, pharmaceuticals does play a part, but it shouldn't be the sole answer. So ways to manage your chronic pain. Mood needs to be addressed. Likely, if there's chronic pain, there's stress, depression, anxiety related or concurrently occurring. So engaging in your GP or your psychologist to understand how to perform meditation, yoga, distraction music, therapy, exercise, medications to address stress, depression, or anxiety. Because with chronic pain, your nervous system is already on high alert. When you're stressed and anxious, you're doubling this alertness of your central nervous system. So it's no wonder that you're constantly feeling or in pain. So address that, and therefore, hopefully you can reduce your pain experience over time. Maladaptive cognitive thoughts or behaviors, so fear, catastrophizing, so continually thinking about thoughts, playing the what if game. Fear avoidance, so avoiding certain situations, avoiding certain movements, only negatively reinforce that particular situation, context, or movement. And remembering that people think that tissue damage is occurring, so they're very afraid to move and think that they're making their condition worse, which in fact that likely isn't occurring. So psychotherapy is really helpful for these sorts of things. So cognitive behavioral therapy, addressing your thoughts, acceptance and commitment therapy, both CBT and ACT therapies can be done with a psychologist, and they've got a good research base behind them that they're quite that they can certainly help. Physiotherapy can help with movement and exercise guidance, and general education from both of these professionals and others about what chronic pain is and how you deal with it can certainly help improve your self-efficacy and locus of control. Sleep is very important. There's certainly a bidirectional, actually all of mood, maladaptive cognitive thoughts, and sleep both have a bidirectional relationship with chronic pain. Sleep is really, really important. If you're not getting restorative sleep, you're likely, you're less able to deal with and cope with your pain, and it ramps up, turns up the dial of pain or the perception and feelings of pain. So you might have problems with going off to sleep, so sleep latency. You'll likely have microarousals or awakenings with pain, whether it's the pain that wakes you up or then the poor sleep cycle or architecture that then develops thereafter having chronic pain. You might be waking early, which is quite common with depression, and then having trouble getting back to sleep. And then other people suffer from sleep apnea. So especially if you're highly stressed, highly anxious, have anxiety, relaxation strategies are really important to engage in before sleep. Try to get rid of your phone. Don't look at your phone and things like that with blue light before bed. A good bed routine and sleep hygiene are important. So no caffeine, for example, before bed. A warm bath can also help. Going to bed at the same time or roughly the same time also helps. Go to bed when you're tired. Don't go to bed when you think you should and then continually watch the clock. That's going to just make you more nervous or more anxious about going off to sleep. Get rid of the clock. If you're having a hard time battling your thoughts, it might be an idea to get up out of bed, quietly sit down in a comfortable space and record your thoughts and the things that you might do tomorrow. And lastly is acceptance. While it doesn't make it any easier, of course, accepting that this is part of the chronic pain experience, that you will have sleep issues, and not to be afraid of that. Being afraid of sleep can only heighten the sensitivity of the impact of not going to sleep, and that can in itself can become a hugely vicious cycle. So those are some tips to help manage your chronic pain. I hope this episode of empowering you about reframing your pain has helped. Hopefully that it's educated you. You can understand chronic pain a little bit more. And then hopefully some of those tips have prompted you to have an open and frank conversation with your GP or other healthcare provider. Please send me any feedback or questions to my email or the info@arthritis email, or call us on the 1-800 number. Thank you and take care.